we'll get started. It's the top of the hour. Good morning, everyone. And thank you for joining the Superior Health Quality Alliance today for our COVID-19 All Settings call. My name is Barbara Link, and I am a quality consultant with MPRO, which is a partner organization of Superior Health Quality Alliance. Today, our topic is COVID-19 and the flu season, how to navigate the potential pandemic with our presenter, Dr. Jay Gold. Before we get to our presentation, I do have just a few housekeeping items that I'd like to go over. Elena, thanks. So as always, please mute yourself when you're not speaking, and remember to unmute yourself if you have a question. Please state your name and state an organization when participating. If you're on the phone, please press *6 to unmute. Do not disclose any personal health information if you're discussing a patient situation. And if you're having any trouble with Zoom, you can always message Elena Smith in the chat box and she will help you out. If you have questions or comments, please chat them in so everyone can see them. But also, we always encourage you to speak up and state your question as well. Please, as a reminder, we are recording this session today so people can view it at a future time. I also wanted to just provide a reminder. If you have not enrolled already, please to take full advantage of Superior Health Quality Alliance Healthcare Quality Improvement Initiatives. You'll need to enroll soon. We will have our kickoff webinar on Thursday, November 12th from 1 to 2 o'clock Central Time, and that's 2 to 3 o'clock Eastern Time. You will need to enroll to be able to attend, and Elena will post the enrollment link in chat. Once you enroll, you will receive an invitation to our kickoff call, and that will provide a comprehensive orientation to Superior Health's free quality initiatives over the next 4 years. So by enrolling in our quality improvement initiatives, we will help you to accelerate and improve your quality improvement efforts and help you develop plans for future initiatives with our 3-strategy approach. Superior Health Quality Alliance wants to provide you flexibility and guidance while you work to meet the competing priorities that arise in this complex healthcare environment that we're currently in. So we offer the technical assistance you need to provide the best possible care to the patients you serve throughout our region. So please take this opportunity to copy the link in chat and join Superior Health Quality Alliance if you haven't done so already. We really look forward to working with you. I'd like to also invite you to our last COVID-19 sharing call of 2020. This will take place on November 5th at our regular time from 9 to 10 Central Time and 10 to 11 Eastern. This will be a panel of family caregivers that experienced firsthand their loved ones' struggle with COVID-19 and their diagnosis and how they navigated the healthcare system as a family. The panel will be moderated by Dr. Jane Peterson, who is the CMO at Stratus Health, who is a partner organization of Superior Health Quality Alliance. The panel representatives include a daughter, as well as a wife of COVID-19 patients. They will discuss their journey with hospital, SNF, and home care services during the COVID-19 pandemic. So please join us on November the 5th, and we will please also look for that invitation soon. So without further ado, I would like to segue into our very important topic for today. It's very timely. On the COVID-19 and the flu season, how to navigate the possible twindemic. Our presenter today is Dr. J.A. Gold. Dr. Gold recently retired after 27 years as Senior Vice President and Chief Medical Officer of Medistar, Inc. That is a partner organization as well as Superior Health Quality Alliance. He received his MD from Texas A&M, his JD from New York University, and his Master's in Public Health from Harvard. His specialty certification was in preventative medicine and public health. He recently stepped down from the position of Speaker of the House of the Wisconsin Medical Society. He served as chair of the Wisconsin Heart Disease and Stroke Alliance and was a longstanding member of the Wisconsin Council on Immunization Practices. He served on the faculty of the University of Wisconsin School of Medicine and Public Health, the Medical College of Wisconsin, Marquette University Law School, and Pennsylvania State University College of Medicine. He currently is a master's candidate at the Graduate Institute of St. John's College. My goodness. So with his wide experience, we are very excited to have Dr. Gold today present on this very important topic. And without further ado, Dr. Gold, thank you.
Thank you, Barb. By the way, I will not be able to see the chat during my presentation. So I absolutely encourage people to post questions, and I will get to those when I'm finished talking. So I want to start by thanking thanking you all for asking me to come and talk about this very important topic, and to thank you for the work you're doing, because on account of your work, lives are being saved and people are avoiding hospitalization. And thank you for that. Talking about flu and COVID, I'm going to start simply with an MMWR report. This is a CDC Morbidity and Mortality Weekly Report, which is their regular publication, came out 2 days ago, and had data showing that hospitalized patients with COVID-19 in the Veterans Health Administration had a more than 5 times higher risk for in-hospital death and increased risk for 17 respiratory and non-respiratory complications. So more than 5 times higher risk than did hospitalized patients with influenza. COVID, for the most part, is rather more virulent and rather more lethal, though you do have a spectrum of severity of illness in both diseases. Patients with COVID-19 had almost 19 times the risk for ARDS, that is acute respiratory distress syndrome, than did patients with influenza, and more than twice the risk for myocarditis, deep vein thrombosis, pulmonary embolism, intracranial hemorrhage, acute hepatitis and liver failure, bacteremia, and pressure ulcers. On the other hand, the risks for exacerbation of asthma and COPD were lower among patients with COVID-19 than among those with influenza. The percentage of COVID-19 patients who died while hospitalized, which was 21% in this study, was more than 5 times that of influenza patients, so it was 3.8. And the duration of hospitalization was almost 3 times longer for COVID-19 patients. So for the most part, COVID-19 is a worse illness, and it's something to keep in mind. We're going to be spending a fair amount of time talking about the difference in symptoms. You know, how do you know what you have and what do you do about it? One thing that you'll note is that a lot of times the symptoms can be very similar, symptoms of the 2 diseases, so that short of a test or maybe 2 or 3 tests, it may not be possible to know for sure, but there are some clues. I should note that it is possible to have both COVID and flu at the same time. Some patients in China this year were found to have both. I should mention at the outset that it is not clear whether we're going to have much of a flu season this year. Flu activity in the Southern Hemisphere, which often predicts activity in the United States, was 99% below normal during its winter, which is our summer. And the epidemiologists are saying this is because those in the Southern Hemisphere, Australia, New Zealand, South Africa, and South America and so on, they were wearing masks, they were distancing, they were washing their hands to prevent transmission of the coronavirus. And these are the same precautions as you would expect that also prevent flu transmission. And because there aren't a whole lot of flights between the Southern Hemisphere and the United States right now, there may be little opportunity for the usual seasonal influenza strains. There are 4 strains that you're worried about, a little opportunity for them to reseed themselves among Americans. If they do, masks and social distancing should limit their spread. Of course, we don't know. It's possible that the reported low levels of flu in the Southern Hemisphere are actually the result of fewer people seeking medical treatment because of pandemic-related restrictions, or because they were afraid to leave their houses, and that could translate into flu cases going undetected and unreported, although we are hopeful that the precautions people are taking for COVID will also lead to a less extensive flu season.
Dr. Gould, I apologize, but there was one thing I forgot to mention to everyone, and they did just chat it in. They were wondering about references that you're citing, and we did send out article links that Dr. Gould wanted us to post in the invitation, but Elena just put all those links to the articles that Dr. Gould is referencing today in the chat, so you can access them as well. So I just wanted to make sure people had that information up front.
Thank you so much. Yeah, these are articles that are directed to the public. I didn't put in articles directed to health professionals because the ones that I sent out were well synthesized and very reader friendly, and they're things that you can share with others. And if you look, you'll see where I'm getting a lot of my information. I will reference 1 or 2 of them in the course of this talk. Should say something about flu shots before I go on. Everybody over 6-month-old without contraindications should get a flu shot. Last year's flu season, before it ended abruptly during lockdown, was on track to be one of the worst in recent memory. So obviously there is some concern about what could be down the pike this year. And there were some findings that were posted in JAMA but haven't been peer reviewed, suggesting that getting a flu shot may be linked to protection against COVID-19. But as I say, these aren't peer reviewed and are only suggestive. The word twindemic was used in the title of the talk, and you're seeing that word used to mean situation where the COVID pandemic and a flu epidemic coexist. And obviously that not only kind of bad in itself for people, but can put an enormous strain on the healthcare system, because a certain percentage of patients with flu do develop pneumonia, have to be hospitalized, and some of them die. So in addition to the pressures that are being put on hospitals by the COVID pandemic, a flu epidemic would increase those pressures. So flu shots this year were made available in large numbers and distributed to pharmacies and doctors' offices beginning in August, which is early. And people are getting them. I went to Walgreens yesterday to fill a prescription, and the pharmacist told me that they were giving shots to 4 times the number of people as in previous years at this time of year. And there have been spot shortages reported. Some doctors have reported difficulty ordering as many as they want, but pharmacy chains say they're getting steady supplies, all the more reason for people to be getting the shots now. I would note in the links, one of the links is to a WebMD page, which gives a very nice chart on the different symptoms of cold, flu, allergies, and COVID. And I'll go through some of those. You all know the symptoms of the flu: fever, headaches, body aches, sore throat, runny nose, stuffed sinuses, coughing and sneezing. And for infants, you can see ear infections. And some, especially children, get diarrhea or vomiting. The most common severe complication, as I mentioned earlier, is pneumonia. And the typical sign of flu pneumonia is shortness of breath, especially when you exert yourself, and unusually rapid breathing. Doctors typically look for that in children, and sometimes pain in the chest or back. Now, I should mention that shortness of breath may develop a little later in flu cases that convert to pneumonia than you'd see in COVID. Sometimes you'll see it stated that you don't see shortness of breath in flu, and technically that's true, except when you get pneumonia, so I wouldn't put too much stock in that. By comparison and contrast, the most common COVID-19 symptoms are high fever, sometimes with chills and shaking rigors, a dry cough, and fatigue. Those have been your hallmark symptoms. The only one that really distinguishes the two infections is anosmia. Many, perhaps most, COVID-19 patients suddenly lose their sense of smell. I saw a study where it was like 7 out of 8 patients. And this is not only because they have a stuffy nose, but because something happens in their brain and their smell goes out, and they don't even register strong odors like onions or coffee. And this obviously affects the sense of taste as well. Less common symptoms, though you do see them, include sore throat, congestion, runny nose, vomiting, diarrhea, stomach pain, and feeling somewhat out of breath when exerting yourself. Again, so the similarities to flu symptoms. Sometimes you get red or itchy eyes, as you might in allergy, and some get redness in the or blisters in the fingers or toes, so-called COVID toes, which resemble chilblains. This is usually seen in younger people, teenagers. More dangerous episodes include serious breathing difficulty, pain or pressure in the chest, blue lips or blue face, confusion or incoherence, so-called brain fog, and the collapsing or losing consciousness. COVID can cause blood clots that lead to heart damage, brain damage, and lung damage. A fair amount of the serious effects of COVID does seem to be related to clotting. And even some cases that appear to be mild or symptomatic create signs of what doctors believe may be long-lasting heart damage. Obviously, we don't have the long experience with the SARS-CoV-2 virus to know, but it looks that way. And you sometimes get what's called happy hypoxia. This is where you develop pneumonia without realizing how sick you are. You feel pretty good, you're breathing okay, but your oxygen saturation is quite low and dangerously low. So pulse oximetry that measures oxygen saturation has become crucial. Also, children can get a rare but deadly immune system reaction known as MIS-C. That's multi-system inflammatory syndrome in children, in which various body parts become infected. I was asked to distinguish flu and COVID symptoms from seasonal allergy. Many of the symptoms you see in the others, you don't see in allergies. You don't see fever, malaise, exhaustion, headache is uncommon, and you only see shortness of breath in allergic asthma when it gets really bad. What you do see is congestion, sneezing, red itchy eyes, and you may see fatigue, sore throat, and cough. Whether or not to get a COVID test if you have cold or flu symptoms is a complex issue about which the opinions of experts differ. And I don't have the expertise of a lot of these people who are on both sides of this. But I would say for myself that if I have even the slightest concern that I might be showing COVID symptoms and testing is readily available to me, I'm going to get tested. But as I say, this is controversial. So having gone through all that, why don't I pause now and see if people have any questions? So I'll turn it back to you, Barb. None in the chat yet.
Dr. Gold, this is Jerry Henniker, and I was wondering if I could ask you a question. You know that they're seeing increase in people getting flu vaccine in a lot of the pharmacies. And I'm wondering if part of that might have to do with, a lot of offices are closed. Excuse me. A lot of offices are closed and used to give the flu vaccine to their employees in the offices. And so now those employees are needing to go to pharmacies. Do you think that could account for some of it?
Yeah, it's a good point. If you can't get the shot where you typically get it, and as you point out, many workplaces have offered it, then since it's still important to get it, you're apt to go to a pharmacy or to a clinic for it. So I think that may account for some of the rise. My hunch is it's nothing like all of it, but that's just a hunch. I can't give you numbers on it, but it's a very good point. Thank you.
I do just want to remind everyone that if you are joined by phone only and you'd like to ask a question aloud, you can press *6 on your telephone and that will unmute you.
Hi, Dr. Gold. This is Amy Weigel. I noticed an article yesterday that had come out defining close contact, which originally the CDC was stating was 15 minutes. But now it's stating that it sounds like it can be an accumulation of a 15-minute period over 24 hours.
Right.
Okay. I didn't know if there was anything more we needed to elaborate on that with that, but just we need to, I think, view that close contact much differently, obviously, with that information than previously.
That's absolutely right. They did change the definition of close contact, which had been spending a consecutive 15 minutes within 6 feet of somebody. And now it's a cumulative 15 minutes over 24 hours, quite as you said. This is really for epidemiologic purposes, because what they found is that patients, or I'll say people who had been spending time that was not cumulative with somebody who turned out to be infected, but who did not meet the old definition, still had a significant risk of contracting the virus. So this is meant to help with informing and contact tracing and so on. and so this affects what the health departments are doing and what the clinics are doing. As far as the advice we're giving just to people who might become infected, the advice is the same: masking, distancing, washing, and so on. The advice hasn't changed. It's simply a matter of how you handle it from a public health standpoint. Have I answered your question, Amy?
You have. Thank you.
Sure. I see a couple of questions here. Racial disparities and how they view the idea of vaccines. Yeah, there have been issues here. There is much discussed distrust, particularly in the African American community. The distrust tends to be somewhat higher of the healthcare system in general. And this goes back to things like the Tuskegee syphilis study, where, as you may know, poor Black men who were diagnosed with syphilis were not given penicillin, even though it was available, so that the natural history of the disease could be studied. And it's fairly widespread knowledge in the Black community that this happened. And there have been a bunch of other things as well. So that also means that there's a little more suspicion of vaccines. That said, you see a lot of suspicion of vaccines throughout the community, not just in minority communities. You see the rise of this anti-vaxxer movement, and that has not simply had to do with flu shots, but with all kinds of shots. You've seen it with measles, which has led to outbreaks, including the one a few years ago at Disneyland. And it's a kind of a general problem, and it's something that the messaging for vaccines really has had to address. It's unfortunate, but I think it really has to be done in all communities, although there are, as I said, particular issues that have to be addressed in the Black community, especially with regard to healthcare in general.
And I know this is sort of, have you heard of anything, or maybe even other people in the audience, about maybe community health workers having a positive impact on some of those situations to be able to communicate with different populations, or any specific programs that maybe have intervened with some of that? I know
I'm not familiar with those, I'm afraid. So I'm going to have to plead ignorance on it, Barb. Sorry.
That's okay. I'm not either. It just was a thought that I had, that sometimes, those community health workers who are in the community maybe have some impact, but I don't know if that's something that they're doing or not.
Yeah. Okay. And I see a question from Katrina Nordyke having to do with masking. I'm trying to remember. I think that the close contact is within 6 feet and unmasked. So masking definitely helps. Obviously, the best advice is to stay more than 6 feet away and to wear a mask. When you're outside, that can be less important. I see people being outside more than 6 feet away, unmasked, and not running into problems, but I don't recommend that when my family gets together with other family members that we're not in a pod with. We're outside and we're distanced and we're masked. So we are taking as few chances as possible. But I think that wearing a mask is going to be very important from the point of view of avoiding close contact. Other questions?
And just a friendly reminder, you can chat your questions in, or you can unmute yourself and ask your question directly. We're willing to take them by either way.
This is Amy again. I'm just curious then too on, because of obviously flu season, it's even more prudent to be wearing masks consistently, which I've been doing, but we're looking at possible return to our office. And I'm just wondering if I haven't come across anything very distinct about the type of mask. You can have the cloth mask with the 2.5 filter that you can insert, or some people just have a plain, just one layer mask. I have a CDC recommendation that I had looked up, and I wasn't finding anything still very specific to that. Is there anything that you can recommend specifically?
Yeah. So first of all, and this is more important than anything else I'm going to say about it, the best mask is the mask you're going to wear. So if the mask should be comfortable enough that you're able to wear it for whatever period you need it. Whether it's a single layer or several ply, there does seem to be some reason to believe that that having a 2 or 3 ply mask might offer some greater protection. But even a 1 layer mask can provide substantial protection. The N95 mask, which is used in healthcare settings, actually has the advantage that it can, the mask people are typically wearing, the cloth mask, prevents you from spreading the disease more than it prevents you from contracting the disease, although there is some effect on it in both directions. The N95 can offer more protection to the wearer, but only if it's fitted, and fitting it takes a certain amount of skill and expertise. So simply taking an N95 mask and putting it on without fitting it may not offer that much greater protection. I would also caution people that you sometimes see these masks that have these respirators built into them. Those are no good. Those will not prevent transmission, so don't wear those.
Right, but you mean the one-way valves? I know they can still spread.
Yep.
Is that what you're referencing? Right. And yeah, I know that there's concern for fit testing as well. And it's just the challenge is that if we're in an office, it's for home health care. We want to leave our N95s for our patients that, our clinicians that are seeing patients with, of course, the aerosolized procedures and so on. But just there's some just have been putting, they say you can do the scarf and just putting that over kind of your mouth and just not knowing for sure the best. So possibly the
a scarf will work, but usually not as well as a mask. If it's an office, I think it should be easy enough to have a pile of masks there that people can use if they're not wearing masks of their own. But definitely people should be masked. And one other thing I would mention is that you should change or wash your mask daily, because it can it can get elements of the virus on it, and putting on a used mask it might be dangerous.
Okay. Thank you. And you're referencing just the cloth masks, obviously, that you would wash, because I've heard some people say that I've actually heard people say that they want to reuse their surgical masks after washing them or microwaving them. Things like that, that would obviously compromise the integrity of the mask. I have asked them to not do that.
Yeah, obviously, in washing them, you don't want to mess up the mask, or that will defeat the purpose. I completely agree, and that's true of any kind of mask.
Thank you.
Hi, Dr. Gold. This is Janelle Shear from Superior Health here in Minnesota. Thanks so much for all your information. I have two questions.
Hi, Janelle. How are you?
I'm good. So on the mask topic, I'm wondering about the masks with the little filter, So like when I went to my dentist, I noticed my dentist was wearing a mask with these little filters, and that made me a little nervous, because I've read that the filters would protect, the person wearing them from stuff coming in, but not necessarily going out.
Yeah, this is I think you may be talking about the kind of respirators that I was talking about. These round things in the middle of the mask. Is that what you're referring to?
Yeah, well, it was on the side, but
off to the side. Yeah. I don't want to cast aspersion on your dentist's office, because I don't know what kind of masks they were using and what kind of precautions they were taking. Obviously, in a situation like that, it's extremely important for them to be real sticklers about everything, because they're getting close to you. And you're going to be unmasked even if they're not. But as I say, I am recommending people that if they're using an N95, that there should not be a respirator in it. As I say, I'm not. I can't criticize what your dentist office is doing without knowing more about it, but that's what I'm recommending.
I mean, everything else seemed perfect, and I was very pleased. But then when I saw that, I was just a little wondering, and I obviously didn't have the guts to ask. So my next question is, I've been hearing more and more about the flu vaccine for people that I believe you have to be over 65 to get, and it's supposed to be more high powered. Can you talk a little bit about that, please?
Yeah. One of the reasons that the SARS-CoV-2 virus is more lethal in older people is that their immune systems start winding down. So I'm 70, my immune system is nowhere near as robust as it was a few years back. And that's true as well for making antibodies in response to vaccines, and the flu vaccine in particular. So in order to increase the likelihood that the body is going to manufacture adequate antibodies to fight off the flu if it comes in the strains that are in the vaccine, over the last couple of years, the CDC recommendation is that people over 65 get a stronger dose of the vaccine. When I got my flu shot last week, they gave me the stronger dose, and my arm hurt like hell for a day. That's one of the things that's more likely to happen when you get that. But it did give me somewhat more confidence that the shot would be effective, and that should be true for all patients in that age group.
Thank you.
Did you say people over 55 or 65?
65.
65? Okay,
6, pick up sticks.
thanks.
So then I wonder, are they also giving it to people that are immune compromised, or are they just stop doing the age requirement?
This is an area where I'm going to say people who have any issues with compromise of their immune system should contact their own physician. Typically, the one real contraindication to getting the flu shot, the one serious one, is allergy, particular allergy to eggs, the history of bad reactions. People who have some kind of immune compromise, people taking steroids, that sort of thing, usually will get their flu shot. But if there's any question, people should get their own doctor's advice.
I believe you addressed this one. I just want to make sure. Katrina Nordyke asked, thank you for addressing the time component with close contact. Could you please describe how wearing masks influence close contact definition?
I think I addressed that.
Just wanted to make sure.
Okay, and here's another question here from Jerry. What should you do if you think the flu shot you received wasn't given in the arm muscle, felt like it was given more in the fatty tissue? Yeah, it is supposed to be given in the arm muscle, but people vary in their level of competence. We've seen it where sometimes they'll hit a nerve or something, and but it seems, and again, I can't speak to any particular situation. I mean, if somebody came to me and said, I'm concerned that about the flu shot, I'd ask questions. Where did you get it? How did you feel? And so on. But in general, if they've given you the flu shot in your arm, it may not be that easy to tell where they gave it just from how it feels when they put it in. And if they've injected the flu shot into your arm, I would have a certain degree of confidence about that it actually is being taken up by your body. I don't remember seeing cases where people got a flu shot and then went into the fat and it wasn't working. I don't really remember seeing that. That's really the best I can tell you.
I have another vaccine related question. Can you hear me?
Sure.
It's a little speculative and maybe you don't know the answer, but I was wondering if when the COVID vaccine comes out and someone decides to get the first vaccine, but say 6 months later, it comes out that that first vaccine was only 55% effective and a new one now is available that's 80% effective, would there be any harm in getting the second one, having already received one?
It's a great question, and I'm going to say with respect, it's a premature question because we don't know what vaccines are going to come out when. We don't know what the mechanism of action of the earliest ones are going to be. We don't know the effectiveness of the vaccines. Vaccines can vary a lot in effectiveness. Flu shots, of course, notoriously may not prevent you from getting the flu, although they may prevent you from getting the flu. And if they don't, you're apt to have a much milder case of it. But we just don't know. So I would just say, keep your eyes open, because when there's more than one vaccine, you're going to see recommendations from CDC and from public health agencies and from Dr. Fauci. Those are the ones that I'm going to pay attention to in making my own personal decisions. Keep in mind that when the vaccines are rolled out, it's going to take a while for it to get to everybody who needs it. There are the logistical issues, not only in manufacturing the vaccine, but in manufacturing the delivery mechanisms, the syringes, in getting enough vaccines to the right places. No doubt there will be prioritization as to who gets the first vaccines. We've seen that before with the vaccine for the H1N1 a few years ago, where you would see top priority being healthcare workers with patient contact, and then you may see people who are in the highest risk groups. So it may take a while before all this gets rolled out. So a lot of decisions may depend on that, as well as just what is available at any given time. But it's a good question, and I would just pay attention to what's happening and what the recommendations are.
Yeah, thank you.
I do see a few people unmuted. I just wanted to make sure if, I don't want to put you on the spot, but I see Jane Hindershield is unmuted. Did you want to ask a question, or was that just by chance that you're unmuted?
Can you hear me?
Yes.
Oh, no, I unmuted because my computer speaker wasn't working, so I'm on the phone and I was trying to get the computer to work.
Okay, thanks. Just wanted to check in and make sure. Okay.
Yeah, it's real interesting hearing the cumulative with wearing the mask, and the cumulative effect is not wearing the mask rather than, the consecutive issue. I think that's going to be a real interesting application in the hospital settings, because we've just been going by that consecutive 15 minutes.
Yeah, that's a definite change.
So thank you.
So Barb, this is Mary.
Hi, Mary.
I just want to make sort of an observation and a recommendation to our participants today, and that is, share this recording with your employees. I think they'll find it very interesting and helpful, not only in their personal lives, but of course, as they work with you and for you. And then share the articles as well. There's some really great learning opportunities here that we're all engaging in. So I'm hoping that you'll all not only enjoy this yourself, but please take it back to your colleagues and to your staff, all the staff.
Great
I don't
suggestion.
see a link
Thank
to the.
you. Oh. Let's see. I think Elena just reposted a link to the articles referenced today in the chat. They also, with any of the materials that we have and future invites, we always send out the information again. And so this webinar will be posted to our YouTube channel, and any of the resources will go along with that. So you should be receiving them as well. If for some reason it's a bit of a challenge to get those out of the chat, but Elena just reposted them again. And yes, just to support Mary's suggestion, there is a wonderful grid in one of the articles that's a comparison chart that's very easy to read and communicate.
That's the WebMD article. I found that very helpful in putting my own talk together.
Yeah. So Dr. Gold did some great research to find some very user-friendly articles that can communicate at all levels of education, I think, that you could use for staff, for patients, for family members and friends, across the continuum of care. It's very nice. So please take advantage of that. And
It
of
just
course,
post
yes,
the link to the YouTube in the chat as well. And then I'm going to also be posting a link to an evaluation. If you could let us know how we're doing with these calls, if there are any other topics we can feature in the future, we'd really appreciate it. It helps us direct what your interests are for the content that we put out.
I have another quick question, if I could. This is Amy again. I know there's a flu block available. I know that there are people that have had, they have the issues with the allergy type thing to eggs and the anaphylactic issues and so on. How effective is the flu block to get with the flu shot?
What's the question though?
So I've heard about the flu. You can get a flu block. It's like a shot that you take before taking the actual flu shot.
I'm not familiar with that. That doesn't mean it's not a real thing. It's just maybe one of those things I don't know about.
Okay. Yeah, I wasn't sure how reputable the information was. I had recently heard about it. I didn't look anything up on it.
Yeah, I don't know anything about that, which, as I say, proves nothing.
Okay, thanks.
okay.
So this will be this talk will be posted on the Superior Health QIO YouTube channel.
Mm-hmm. That's correct. Yes.
Okay, because I may want to access that myself at some point.
Okay. Yep. Yes. And so any of the information and articles that you provided today, the link will be there. And then as well as the YouTube channel, we'll post the webinar as well as any past or future COVID-19 all sharing calls are posted in the same spot. So yes, you can take access of that. Looks like we have a little over 5 minutes left today. Any last minute questions that anyone has for Dr. Gold? We certainly appreciate his expertise and wide breadth of knowledge today. I'm a big advocate of getting the flu shot and see its benefits. I am someone who 1 year missed it because of having a baby. Just did slip my mind, and I will never, ever not have the flu shot again. So that's just personal, and I don't know how professional, but I personally am a big advocate for the flu shot. I've always felt that it really does protect myself, protect my family, and protect the public as well. And I think especially given the current climate, it's incredibly important if it's, appropriate for you to get. I really appreciate his advocacy. And is there someone who has another question?
Yeah. Yes, I have a question about the flu mist.
Yeah.
So if someone gets the flu mist and some of the solution comes out through the nose because it wasn't given high enough or it wasn't administered accurately, how protective or how concerned should we be about protection for that person?
I'd be concerned. Obviously there's a certain amount of leakage that you might get even if the flu mist is inserted in exactly the right place in the nose. But it's possible for it to be down so close to the nares, so close to the surface that it's not getting up there. So if there are any questions, I would just take it up with your provider. It's really the best thing I can tell you there. Usually they're pretty careful about how they give the flu mist, but that doesn't mean that in any individual case they were careful. So I would ask further of your own physician or provider.
Well, again, this was a lot of information today, but really appreciated all the questions as well as Dr. Gold's presentation. I think it was quite comprehensive, covering an awful lot today, and we really appreciate it very much. Again, the articles are posted in the chat, but will also be posted in the materials that will be sent to you after the presentation. And Elena has posted an evaluation in the chat. We also are very interested in finding out any of your concerns or questions you may have around quality improvement efforts at your particular facility. And so we can start gathering topics for future presentations as well as for our interventions as we move forward into our implementation phase of our quality improvement work next year. So please, you could probably provide that information in the evaluation or chat right now as well. So we really appreciate that as also. Cannot thank Dr. Gold enough today. We really appreciate it. The presentation will be posted to our YouTube channel. We look forward to you joining us on November 5th for our last COVID call, and you'll be receiving that invite. And thank you everyone for attending today, and appreciate it very much. Thank you all.